This video is presented by the Wisconsin Division of Public Health and is funded by a grant from the Centers for Disease Control and Prevention.
Influenza shots available now. Is it that time already?
Yes. Let's make it a goal for everyone on our unit to get immunized for the sake of our patients. You know, it only takes a few minutes to help prevent a potentially serious illness. Catch you later.
Karen, do you mind watching the desk for a little while longer? I think I'll take a quick break to get my flu shot while it's still quiet.
Sure, no problem. You're braver than me, though. Those shots can make you sick. Trust me, I know. It happened to me a couple of years ago. I got my shot, and 2 days later, I was so sick I couldn't even move off the couch.
Anyone who works in hospitals, nursing homes, clinics, home health, or any other patient care setting should receive the influenza vaccine, but not everyone does. However, heightened awareness of patient safety prompts more healthcare workers to become vaccinated. By doing so, they take an important step in protecting their patients.
Hello, I'm Dr. Jeffrey Davis, and I'm the Chief Medical Officer and State Epidemiologist for Communicable Diseases and Emergency Response with the Wisconsin Division of Public Health. Influenza vaccination of all employees who work in healthcare facilities is very important because people who take care of patients in these settings or people who have other responsibilities in these settings can transmit influenza virus to patients and to residents in these facilities. This concept has been very well documented in the medical literature. Influenza is not a disease to be taken lightly. It can cause serious complications, resulting in hospitalization and even death. People at greatest risk include the very old, the very young, and people with underlying medical conditions. This describes many of the patients and residents in these healthcare facilities. When facilities achieve high rates of healthcare worker influenza vaccination, patient mortality rates can be reduced by up to 50%. No other single step taken by healthcare workers reduces patient mortality to that extent. Working while ill is another very important problem. Ill healthcare workers may have impaired job performance. Impairment in job performance can result in committing errors. These errors may be associated with harming patients. You may have heard of this relatively new term. It's called presenteeism, and it poses a serious threat to patient safety.
Receiving the influenza vaccine is critical in the healthcare setting, but the vaccine also protects your family, friends, and coworkers. Most reasons for deciding against the vaccine are based on misconceptions and misinformation. Please watch as we dispel the myths about the influenza vaccine.
I got my shot, and 2 days later, I was so sick I couldn't even move off the couch.
I've never gotten sick from the flu vaccine.
Maybe you're lucky. I've gotten sick several times from the shot. I think it's hit or miss.
Thanks, now I don't know what to do.
It's true. People can become ill after receiving influenza vaccine, but the cause is not the vaccine. During the influenza season, there are a lot of respiratory viruses that cause influenza-like illness. So Karen could have been infected with one of those. Also, influenza vaccine does not protect against the viruses that typically cause vomiting and diarrhea.
With any vaccine, there's risk of mild side effects. Not long after vaccination, you may experience redness, soreness, or swelling at the injection site, a mild cough, fever, or muscle aches. These effects last 1 to 2 days. Any more severe complications are rare. So, you ready? Good afternoon, Thomas.
Hey, Nancy.
Guess what I have in my cart? Flu shots.
To be honest with you, I've never gotten the flu. I guess I'm just immune.
You still have about a 10% risk of getting influenza. In a matter of seconds, I could cut those odds down by at least half.
Well, then I better get it.
It is also possible to acquire influenza and unknowingly transmit it to others. A few minutes of your time will protect your patients, and it will provide you with peace of mind.
I've given hundreds of shots, but it looks a little different on this side of the table.
You know, I feel the exact same way, but you know, if my kids can do it, I'm all out of excuses. Besides, a couple of seconds of dull pain is better than a week at home.
Especially when the kids are home all day.
You got that right. Well, besides, I can't start thinking of all these patients suffering from influenza on top of all their other medical issues. And I wouldn't want to be thinking I'm the one responsible for giving it to them.
That's a good point. It's easy to forget that being careless in our line of work can really affect people.
Well, if it's the needles that you don't like, you may want to ask about the nasal spray. You may be eligible for that form of vaccine.
Really? That would be great.
Some people may wish to avoid needles. There is a nasal spray vaccine. People who are healthy, not pregnant, and under 50 may receive this vaccine. Both the inactivated vaccine and the nasal spray vaccine are safe and effective vaccines.
Influenza vaccination campaign, my favorite time of the year. Let's see what this survey has to say. Patient health is very important to me, as it is to many of my peers. But I just don't feel comfortable with the idea of receiving the vaccine.
Well, here's one that's a bit more specific. By fighting off the flu naturally, my immune system becomes stronger. I don't think it's as effective to receive the vaccine.
I've heard that one before.
When you develop an influenza illness, you are developing an immunity to that specific virus that's causing the illness. However, during a typical influenza season, multiple influenza viruses circulate, and you won't have protection against the other circulating strains of viruses. Being vaccinated with influenza vaccine every year is far and away the best way to develop immunity against influenza viruses. It is clearly the superior option.
Here's one I've wondered about. Developing Guillain-Barré syndrome from the vaccine.
That doesn't sound good. What is it?
Guillain-Barré syndrome, or GBS, is a rare autoimmune disorder that affects the peripheral nerves and can also affect the muscles used for respiration. The 1976 swine influenza vaccine was associated with an increased incidence of GBS. However, there's more risk of acquiring GBS following influenza virus infection than there is from receiving influenza vaccine.
Are you okay?
I'm fine. Just a little tickle in my throat.
I'm not so sure. Remember, flu is spreading like wildfire right now. You look a little out of sorts.
Thanks.
I'm serious. Maybe you should go home and rest.
If I start to feel any sicker, I'll leave right away.
Have you had your flu shot yet?
No, I haven't.
Well, I finally got mine. It wasn't that bad.
Cindy's right. No ill healthcare worker should be at work. With influenza virus, it's important to recognize that even during the 24-hour period of time before a person is symptomatic, they are shedding influenza virus. As a result, they are infectious to others. The easiest way to prevent this is to become vaccinated.
Influenza can cause serious medical complications. Even relatively mild cases can cause moderate to severe discomfort, which causes people to miss many days of work and school. In only 15 minutes a year, you can save a patient's life, protect yourself and loved ones, and help lower healthcare costs.
Now that you know the truth about influenza vaccines, you know they're safe, that they are effective, that they're beneficial, it's time to become vaccinated. This is very important for your patient's health, for your co-workers' health, for your health. So please become vaccinated. Thank you.